Feel dizzy when you stand up quickly? Do you feel weak or faint sometimes? Well, that could be low blood pressure, or what very few people know as hypotension. Stay with me as we delve into it, know the causes, why it happens, and what you can do about it. Welcome back to the channel. So today we are talking about hypotension, what most people know as low blood pressure. Many people know about high blood pressure, but a lot of them don't know there is also something called low blood pressure, which causes a lot of health issues. Some of the common causes of hypotension include dehydration. And we know dehydration may mean inadequate intake of water, or maybe when you lose fluid through vomiting or diarrhea. And then also we have skipping meals, which is also one of the causes of hypotension. So some people use a certain method. So they skip breakfast, then take lunch, and then skip supper as well. So this can easily predispose you to this condition. Also, when you lose a lot of blood, you already know when you lose a lot of blood, there is not enough to move to the cells and all that. So you may, it's even one of the major risks, all right, of developing hypotension. So, and those who have heart problems and infection are also at a high risk. Then also, BP medications are meant to reduce the blood pressure, but then if you don't take it as prescribed, or perhaps the blood pressure is already low and then you take your blood pressure medications again, it might go beyond or extremely beyond abnormal, let me put it that way, and that will also expose you to hypotension. Now, this topic is very important because low blood pressure causes reduced oxygen, so not enough of the oxygen will be carried to most important organs of the body, and this can be very, very dangerous to your health. So here are some simple tips that you can practice to help reduce the effects of this low blood pressure. First of all, learn to drink enough water. So as I always say in most of my videos, at least 2 to 3 liters of water per day. Then when you are standing up from bed, please, it should be slow. A lot of us, when we get up from bed in the morning, we just jump up at the sound of the alarm and start running around. It is not a healthy practice. So at least try to sit down in bed for some few minutes for the blood to move to certain important areas before you finally get up. Then also avoid prolonged standing. Eat regularly. Ensure you eat on time. All right, it's very, very important. And when you have blood pressure medications, ensure that you go for follow-up always, so that you and the healthcare practitioner can be on the same page when it comes to your treatment, so you don't take medication at a time that would cause other complications to you. So here is when you need to seek help. First of all, when you experience fainting too frequently, kindly seek help. Secondly, when you experience chest pain or confusion, and then also when you check your blood pressure and you see very low readings too frequently, especially when associated with symptoms that I've mentioned earlier, start running to your healthcare provider. So as I mentioned, if your BP, the one at the top, is below 90 and the down one is below 60, please kindly follow up with your healthcare provider. Thank you very much, and see you again.